Take Charge Parenting with the Kids Doctor is brought to you by Children's Health.
Teen eating disorders are on the rise. In fact, more than 1/2 of teenage girls and nearly 1/3 of teenage boys use unhealthy weight control behaviors. Award-winning pediatrician Dr. Sue Hubbard of KidsDoctor.com and children's health psychiatrist Dr. Briana Sacco are here to help. Doctors, good to see you. Thanks so much for being here. Dr. Sue, let's start with you because you know firsthand just how devastating these eating disorders in young kids can be.
Unfortunately, Carrie, I've taken care of too many patients with eating disorders, including anorexia, bulimia, and binge eating disorders. And there's a prevalence rate somewhere, depending on who you read, between 2 and 4%. So pediatricians do see this in their offices.
Dr. Sacco, there are certain factors that may put teens at risk. What are they?
Absolutely. So as the medical director at the Center for Pediatric Eating Disorders, I talk with parents about the biopsychosocial model of eating disorder development. So it's the overlap of biological factors that includes our genetic makeup, social factors that includes our interactions with other people, bullying, and the messages that we get in society, as well as psychological factors, and that it may include perfectionistic behaviors and other things like that. They come together to create a perfect storm that can set the stage for the development of an eating disorder.
So genetics can play a role?
Absolutely. Absolutely. What we know is that the combination of genetic loading and stress can create that perfect combination. The more genetic load you have, the less stress may be required. Some might have less of a genetic risk, but a lot of stress in their lives may set that stage for an eating disorder.
Scary subject, really, for anyone who has kids. So what are some of the warning signs we as parents should be looking out for in our kids?
Absolutely. So you want to be mindful of just changes in weight, up or down, could be a sign of an eating disorder. Changes in how kids are talking about their behaviors, about food, and related to how they perceive their body. Are they talking about having concerns of being fat? Are they going to the bathroom, after they use the restroom?
So if a parent suspects an eating issue, Dr. Sue, what should they do?
I think the first thing you should do is really sit down and talk to your child. Have a conversation about what's going on and their feelings about their body and their health and what they're eating. Secondly, absolutely call your pediatrician and make an appointment to go in. And then it's wonderful that we have people like Dr. Sacco who now we can refer to and get that child in earlier, because we know, like so many things, Carrie, that the sooner they're treated, the better the outcome.
How are kids treated?
So at the Center for Pediatric Eating Disorders, we're a family-focused program. That's one of the important factors in effectively treating eating disorders in children. And so we work really hard both on helping with weight restoration as well as working on some of these cognitive components of these disorders to help kids navigate this world of society pressures and expectations that are unrealistic about our bodies.
I know some parents may be wondering, if my child is diagnosed today, is this something they would have the rest of their life?
Not necessarily. So I can give you a couple of numbers. So at the Center for Pediatric Eating Disorders, we do a follow-up phone call after treatment 6 months later. So we have, on average, less than 10% of children that are readmitted to a program during that time frame.
Okay, so
if you look more long-term, you might be seeing numbers more like 50%, looking at 10 years after treatment, maintain recovery, 10 years after completing treatment.
Good information. Thank you so much to the both of you. We appreciate it. You can find out so much more about eating disorders online at childrens.com and KidsDoctor.com. You can also follow Children's Health and the Kids Doctor on Twitter and Facebook.